Hi, my name's Mark Whitfield. I'm the Systems Development Manager for the Centre for Public Health. Welcome to this Research and Focus seminar, which is today on local surveillance to support intelligence-led commissioning and practice. Okay, so today's speakers, we've got Bev Dejani, who's a Public Health Manager in Wirral Council Public Health, who will be speaking on alcohol screening monitoring that's been going on in the Wirral for the last 5 years. We've got Dr. Maj Shiponda, who's a consultant in HIV medicine at the Royal. He'll be talking about surveillance of HIV testing that's been going on at the Royal. And we've also got Police Sergeant John Lovick, who's works in licensing support in Preston, and he'll be talking about the use of TIG in licensing reviews. The format of today, the three speakers will speak up to 20 minutes each, and then we'll have some questions and answers at the end. Before I introduce the speakers, I just wanted to give you a brief overview of the intelligence surveillance systems that we run at the Centre for Public Health. So the monitoring team at CPH is a source of data on a wide variety of public health topics, enabling key bodies to make informed planning and policy decisions. So working with commissioners, with practitioners, with analysts. We've got a long relationship with data sharing partners across the northwest of England. Some of those systems have held data now across 3 decades, so since the early 90s. And we're working to ensure commissioners have the most up-to-date information as soon as that is possible. So one of that key elements to the monitoring systems is to have flexible and timely data. There's a variety of ways of accessing the information, reports published at different times of the year, online data tables, interactive mapping, which we have currently for some systems, and we're rolling out to others, which allows commissioners, analysts to look at the information at ward level. And then we have various specialities too, including working with users of the systems to facilitate data collection, secure data sharing with those agencies that we work with, and also database development, which is one of our key things that we've been working on in recent years. And with the new public health outcome framework indicators, a lot of our monitoring systems do contribute towards evidencing those, ensuring that the best public health outcomes are achieved. So highlighting some of the indicators here in areas such as hospital admissions, alcohol-related incidents, violent crime, abuse and self-harm, well-being and HIV infection, the type of areas that the systems contribute towards. Okay, so just briefly to take you through very briefly the monitoring systems that we currently provide. TIG, which stands for Trauma and Injury Intelligence Group. So this is an injury surveillance system for routine collection of intentional and unintentional injury data. It's currently collected from 30 out of 31 emergency departments across the northwest. We should have that 31st ED coming on board before the end of this financial year. And we also collect data which is embedded into the system from the ambulance service as well. Some of the areas that we've focused on in terms of themed reports in the past have been things like assaults, including alcohol-related assaults, falls, road traffic collisions, deliberate self-harm, burns and scalds. And the information's been used for strategic decisions and planning, so things like safeguarding board outcomes, the integrated strategic needs assessments on things like young people's emotional well-being, and they've supported health impact assessments as well. The HIV Monitoring Unit, so that collects data from 37 HIV treatment centres across the northwest of England. Data is collected from a variety of different places, including social services and community organisations providing HIV support alongside hospitals. Collecting demographic, treatment and care information. We've got 17 years worth of data within this system now, and the data has been used again for a variety of needs assessments, strategic decisions and planning. So it's informed, for instance, sexual health strategies for GM and Cheshire and Merseyside. And some of the recent work that we've carried out with Cheshire and Merseyside, late diagnosis action planning group, has been identified as by the National AIDS Trust as an example of best practice. The Drug Interventions Programme, DIP monitoring, so this collects data on DIP, engaging with drug using offenders at all stages of the criminal justice system. It is the main source of data on drug use within the criminal justice system currently. Reports on various things such as arrest and drug testing activity, representations, assessments, transfers, caseloads, engagements, outcomes. And the information's used for service specifications and needs assessments. So, for instance, we've explored recently the issue of alcohol being used, linked to cocaine use, which affects the way that services report to DIP and the interventions that are delivered by them. Syringe exchange monitoring. So this monitoring system's been in existence since 1991. Covered currently 41 agencies and pharmacies throughout Merseyside and Cheshire. Reports back on a variety of different fields such as equipment issued, looks at return rates, demographic information and information on substances used. We've always managed to cross-match it with NDTMS data to identify treatment journeys, and the information, as with the other monitoring systems, has been used to inform changes in service delivery. So one of the key things, obviously, in recent years with syringe exchange has been the change from primary drug use of most clients from heroin to steroids. The non-structured drug and alcohol monitoring, part of which is Goliath, which is Liverpool's drug monitoring. So this currently covers 25 services in Merseyside and Cheshire. We've been monitoring non-structured alcohol interventions since 2004. Drugs interventions in Liverpool since 2011, and that's now being rolled out across Merseyside and Cheshire. From the system, we're able to collect demographic and substance use information, mapping many of the fields to NDTMS. It contributes towards the well-being indicator as part of the public health outcomes framework. One of the key things we found with the non-structured monitoring system is that it captures an otherwise invisible population. So certainly in Liverpool, where we've been capturing information on non-structured drug services since 2011, when we mapped the clients over to NDTMS, the majority of clients weren't appearing in the NDTMS data set, which shows that otherwise they would have been invisible in terms of the drug use and data for the region. And we also have, as a key component to that, Wirral, who commission us to monitor alcohol screenings, which Bev's going to talk about shortly. And that's been a very important part of the system because of the huge numbers of screenings that Wirral have managed to conduct over the last 5 years. Just before I introduce Bev, one last thing to say about that. We're bringing together all our non-structured monitoring systems, so your syringe exchange, the non-structured drugs, which is being rolled out across the whole region, and non-structured alcohol into one monitoring system called IMS, which stands for Integrated Monitoring System, which is going to launch in April this year. So it's going to combine those data sets. We've got permission to combine it with the NDTMS data as well. So we'll be able to actually, through this system, provide a comprehensive overview of all contact with drug and alcohol services. As part of it, we intend to roll out the wellbeing questions for all service users and individuals that come into contact with the system. So we should be able to build up quite a good body of data for service users across the region. Okay, so that was just a brief overview of the monitoring systems that we run. I'm going to hand you over now to Bev Dejani, who's the Public Health Manager from Wirral Council Public Health.